Well, the University of Chicago has been a hospital for almost 100 years, since 1927. And we are what's called an academic medical center. And what that means is that we take care of patients, and we try and do that as a very, very important central part of our mission. We particularly take care of patients with very complicated conditions, but not exclusively, and we are very committed to the community on the South Side who live close to the University of Chicago. So that's the central part of what we do at University of Chicago Medicine. But in addition to that, we do a lot of medical research. And so what we try and do is come up with new and better ways of diagnosing, treating, preventing a whole variety of diseases. And then finally, we have an educational mission. So we train scientists, people who are getting PhDs in biology. We train medical students. And then we train people after they have graduated from medical school if they want to specialize in various parts of medicine. There are many positive features about the Affordable Care Act. We are very supportive of it. Obviously, it has allowed people who did not have access to health insurance and to the healthcare system previously to access the healthcare system. As a mechanism of paying for the Affordable Care Act, there are significant reductions in the reimbursement that particularly hospitals get. So this provides us with a lot of challenges in terms of how to afford to do all the things that we want to do. So overall it's a big positive, but it gives us a lot of challenges. We've worked in the last number of years to make the function of the emergency room much more efficient, so that we can see more patients every day without increasing the cost. In other words, the cost per patient goes down. And we're doing that in many different areas of the hospital, looking at ways to save money through using, for example, generic drugs, using special agreements that we have with people who make devices that we need for different surgeries, joint replacement. These require expensive pieces of equipment. And if everybody at our hospital uses the same piece of equipment and we negotiate very hard with the suppliers, we can make things more efficient.